And our correspondent in Kaduna, Lupe Asom, joins me on the news to give us an update on the current situation in that community. Good to see you once again, Lupe. I could see despair written on the faces of the victims of this attack. And then it appears that an apology might not, suffice at this time. Apart from this visit, what other moves have been, made to ensure a total recovery of the victims?
Well, of course, just as you saw in that report, the National Security Advisor visited that place in the company of the governor of the state. He said it was to assess the situation so as to take reports to the president, and then more moves will be made to ensure that justice is served, to ensure that this community gets justice, to ensure that their community is rebuilt. We visited the place yesterday. If you go there, they don't have access roads. We saw their community. They are basically farmers. Some of them just harvested their crops now, and this disaster has come in very, very disturbing. The community is in distress, but the president is assuring that measures are going to be put in place to rebuild this community. If you listen to the vice president when he visited, he said the President Bola Tinubu has set up the Polaku initiative, which is a complete approach to complete non-kinetic approach to ensure that some of these communities in the northwest and indeed even the north central help comes to them. He said it was supposed to begin in Sokoto, but then as a result of this attack, that Polaku initiative is going to begin in Tudumbiri, and he said their communities are going to be built. He said hospitals are going to be built for them. He said schools are going to be built. We visited their schools. Everything is deplorable, just a very tattered building. So that is the assurances the government is giving. They are promising that everybody, relatives of these victims, are properly compensated, and they have assured that this kind of attack would not repeat itself again. This kind of error bombing will not repeat itself again. So those are the assurances we are having from the federal government, and we visited the hospital this afternoon to carry out an assessment, look at the victims, how are they feeling, were promises only made, are they being fulfilled? And we came here to see for ourselves the state. As you can see, I'm right now in the ward at the Barau Dikko Teaching Hospital to talk to some of them and look at them. How are the government responding? Are you getting the treatment you deserve? And I also spoke with some of the medical officials. I have with me here Dr. Samira Mohammed Badamosi, who is a family physician. She has been the one taking care of these people. The deputy medical director has currently taken a leave. He has been working. He just took his time off to take a bath, refresh, and come back. So we have Dr. Badamosi Samira Mohammed. She has been working very hard. Ma, talk to us about some of your efforts to ensure that these people are properly treated and that as soon as possible they are discharged and they reunite with their families.
Good evening. My name is Dr. Samira Mohammed Badamosi. I'm a family physician in Barau Dikko Teaching Hospital. As you can see, the situation now, it's almost getting handled. Everywhere it's calm. We've recorded significant success. The victims are now calm. They are being fed breakfast, lunch, dinner. They have been given full medical attention. The ones that need surgery has been intervened immediately. We had 6 that needed surgeries. 2 males, 2 females, and 3 children, which all the surgeries have been successful, and they are in the ward recuperating well. As you can see here are some of the victims of Tudumbiri in the accident and emergency ward. You can see how happy and lively they are. Some of the children we have here with us, we have 6 orphans who are malnourished. They have background malnutrition. Even before these incidents happen, with now this crisis, they have sepsis, and we are managing them adequately and properly. The government and the management of this hospital and the Federal Republic of Nigeria have put all things and all hands of deck to ensure that they get the best of care.
Okay, ma. What are there specific shortages and limitations in medical resources that you have encountered in the course of treating these people? Are there shortages and limitations in medical resources or equipment in treating these people?
At the initial stage when they came in, we had about 77, which had overwhelmed our facility. Thank God our sister hospitals, one division of the Nigerian Army and 44 Nigerian Army reference hospitals came to our aid immediately. Currently, we have 25 of our victims in 44 Nigerian Army reference hospital. They've discharged some. We have 7 in non-division Nigerian Army hospital, which are also recuperating fine, and some are also fit for discharge towards Monday. And in this facility currently, Barau Dikko Teaching Hospital, we have 43, which almost have are due for discharge. But you know, because of this incident, we can't just discharge them back to the community. They need psychotherapy, they need psychoeducation, they need counseling. We have to prepare them psychologically and adequately before we send them back to the community. In terms of medical resources, we don't have limitations. Everything is available. At any time, you need an intervention, you need a resource, you need a medical personnel. We have everything on deck and we have everything on ground.
Okay, Dr. Samira, can you talk to us about some of the prevalent injuries you are treating in these people? Are they fractures? What are the prevalent injuries that you are treating these victims for?
It's like bomb blasting is like any other trauma. Some of them sustained dislocations, commonly of the shoulder. I think we had 3 or 4 dislocations of the shoulder, which have been appropriately intervened. We had 3 fractures. We had some that sustained abdominal injuries, which needed an exploratory laparotomy, the one I mentioned earlier. 2 males, 1 female, and 3 children, and they have had surgery successfully. So far, we have some that have mild to moderate head injuries. Some have severe head injuries, which are a few out of them, like 5 or 6, which the neurosurgeons have reviewed, and some have even undergone intervention. So basically, the ones you're seeing here are stable. They are the ones that had minor injuries and exit and entry points of pellets from the blast, which the pellets have been removed, and they are stable and they are recuperating well.
Okay, staff well-being is very, very important. The mental well-being of staff, medical people treating these people are very important. Talk to us about the staff well-being. How well are your staff?
Our staff have been incorporated well, though we are, in terms of staff resources, I can say we have a little bit of constraint and challenges, but as medical personnel, as medical doctors, we expect and we are always prepared for emergency. We have emergency response teams, we have mass casualty team, the State Ministry of Health has also come to the aid. Other medical personnel from other facilities have also been mobilized to these facilities. For now, alhamdulillah, everything is on deck. I can say we are doing perfectly good.
So you said some people are due for discharge, but you're giving them psychosocial education. You said some of them are fit for discharge. How many of them are fit for discharge at the moment? At
the moment, we have 13 that are fit to go. But we can't just discharge them to the community like that. We need to give them psychotherapy, psychoeducation. We also need to counsel them before we release them back into the society so that they will be better off and be prepared of the future challenges they might encounter. Because as you all know, this thing came as a shock. They are not prepared. Some of them are not even aware of the loved ones they have lost. It's when they go back home, they will realize the vacancy in their lives. So we can't just release them like that back to the society. We have to prepare them adequately and accurately so that they will be able to undergo this grief and bereavement stage peacefully without any problems.
Thank you very much. So you just heard from her. She said psychosocial education. No. We are not permitted to talk to the victims.
All right. That was our correspondent in Kaduna State, Lupe Assam, bringing us up to speed on the attack in the state where over 80 people were sent to their early graves and several others injured from a military drone attack in an air bombing. We'll bring you more details of this in subsequent bulletins. But Lupe, I was going to ask before the short interruption, what is the latest as regards security around the hospital area and also, reuniting these people with their families?
Well, of course, security have been beefed up in this hospital. We came in, we saw, in fact, it took us some time before we could get access into the hospital because they are making sure that no one who shouldn't have access to these people actually walks into this hospital and gets access to them. So that is the situation now. We also visited their community yesterday. We saw a massive deployment of security troops right from the way down to their village. They have been deployed there to ensure that these people are kept safe. Of course, there are some apprehensions in some quarters that with the visit of dignitaries to this community, it may actually lead to an attack. So security have been deployed to that place. The police, the Nigerian army have deployed personnel to that place to ensure that these people are safe at the moment. And I must tell you, dignitaries are still visiting. Yesterday we had the former governor, we had the 14th Emir of Kano, that's the Khalifa Sanusi. They visited the people, they prayed with them. So that is the situation now.
All right, thank you very much. That was our correspondent in Kaduna State, Lupe Asom, talking to us live from the hospital where the victims of the attack in Tudunbiri community are being treated. Thank you for your time.